This is Dr. Gautam Banga, reconstructive urologist and andrologist working in Delhi NCR. We are doing penile implant on a regular basis and this is one of our specialty. We are getting many patients with a lot of queries and they want to know the answer before they finalize the procedure. One of the major, most important questions which they ask is, what is the life of this implant? So I just want to tell them, or I want to convey, that penile implant is a mechanical device and if it is used properly and without any kind of infection, it can last a long time. It's very difficult to define in years, but there are many patients who are still using even after 15 to 16 years of implantation of the implant. The company which we deal with or the company which provides us the implant are two, that is American Medical System, which is now Boston Scientific, and the second is the Coloplast. Both the companies initially used to have a lifetime warranty, but now with the new terms and condition coming up, they provide a warranty of 5 years, which is applicable for mechanical failure. So in case we put an implant and it stops working because of some mechanical issue, the company replaces the implant. They keep some handling charges, but otherwise they replace the whole implant. And the only thing which the patient has to bear is the surgical fee for explantation and putting a new implant. If there is no mechanical failure and the only problem the patient is facing is the infection, then the warranty doesn't exist or is not valid. And if we have to remove the implant because of infection, then the patient has to bear the complete cost. But at our center, the best thing is that the infection rate is very, very low, which is less than 0.5%. And so the patient can easily consider that the only chance of replacement will be because of the mechanical failure. And they can easily use this implant for around 15 to 20 years if they can use it properly or there is no other mechanical issue with the implant. The second most common question I come across or the patient asks me is whether the sensation and the pleasure and the orgasm with the implant will be similar to a normal erection, or it will be different, or there will be a complete loss of that. So I want to tell you that implant is a mechanical device which is just to aid the erection or to mimic the erection. The skin, the glandular sensation, the ejaculatory process, the orgasm, everything remains the same, and the patient can equally enjoy the sexual activity as a normal person with a normal erection. The best thing about penile implant is that it provides a very good and hard and rigid erection, and so the patient can enjoy the things in much better way than a partially erect or a flaccid penis. So I again want to emphasize that there is no loss of sensation, no loss of orgasm, and no loss of ejaculate with the penile implant. The sexual process remains the same, and patient will greatly benefit with the penile implant if they are suffering from erectile dysfunction and they can live a normal married life or a normal sexual life. One more query which we get in penile implant patient is that whether there will be shortening of the penis with the penile implant. I want to clarify this doubt that penile implant is placed inside the penis and the length of the penile implant is decided on the OT table during the surgery with the measurement which is done after opening the corporal spaces inside which the penile implant is placed. So normally we tell the patient that the length they will achieve with the penile implant will be the stretch penile length. Like if the patient is having a flaccid penis and when they try to stretch it, the maximum stretch length will be the penile length they will achieve with the penile implant. We cannot combine any kind of penile lengthening procedure with the penile implant because penile lengthening procedure doesn't increase the erect penile length, it just increases the flaccid penile length. So they should understand that they will get a very good penile length, that is a stretch penile length, and any erect penis of any size is better than a flaccid penis. So if they can have a good 4-inch erect penis with a penile implant, they can easily perform sexual activity compared to a 6-inch flaccid penis which cannot achieve erection. So I just assure patient that they should not worry about the penile length And they should think of going for penile implant because they can get a good, hard and rigid erection which they can use it for sexual purpose. Thank you.